Well, thank you very much, Mr. Chairman. I'm glad that we are able today to show once again that when Democrats and Republicans come to the table, leave partisanship at the door, we can work together and find common ground on legislation that helps families in this country. Like legislation to reauthorize and modernize the Poison Control Network, which provides a lifeline for tens of thousands of patients and families and health providers each year seeking emergency help for poisonous or toxic exposures. And I want to thank Senator Burr for working with me on this really important issue. And today, thanks to the efforts of Senator Casey and Chairman Alexander, we are also voting to reauthorize another important program that helps kids get critical care, the Emergency Medical Services for Children program. This important program has a very long history of helping improve emergency care so we can be prepared to care for children even when faced with worst-case scenarios. And finally, today we are also going to move forward to, on the Lower Health Care Costs Act. Families across the country have been calling on us to come together and address high health care costs. Democrats have been at the table waiting to get to work on this critical issue. The bill that we are voting on today takes valuable steps in the right direction, and I want to thank Chairman Alexander and our colleagues on the other side of the aisle for joining us at the negotiating table to work through the various issues in this bill and hammer out an agreement. I outlined some of the critical steps we were able to take in this legislation at the last hearing, as Chairman Alexander just did, steps to end the practice of surprise balance billing so that no patient will get caught off guard by exorbitant charges for out-of-network care through no fault of their own, steps to make it harder for drug companies to keep cheaper generic drugs off the shelf by gaming the system, and steps to address the public health crises like vaccine hesitancy, maternal mortality and obesity, and more. Since our last hearing, we have managed to come together and add several additional bipartisan proposals. The legislation now includes additional steps to make sure hospitals and doctors' unique needs are taken into account as we work to end surprise billing. It includes 5 years of much-needed, stable funding for community health centers and other critical primary care programs that help people get the care they need close to home. This provision more than doubles the duration of the previous extension for these crucial programs. It includes a proposal from Senator Murphy and Senator Cassidy to strengthen mental health parity laws meant to help make sure people have access to mental health care. It includes a proposal from Senators Warren and Murkowski to make sure states work with tribal communities to help address suicide. And this legislation follows in the footsteps of my home state of Washington and many other states by raising the tobacco age to 21. And I really want to thank Senators Schatz, Kaine, Young, and McConnell for coming together to raise the purchasing age for tobacco, and importantly, for doing so in a way that will not require states to pass new laws. And I will be pushing to make sure we build on that progress with additional steps to address the alarming uptick in youth tobacco use, like cracking down on flavors, which we know appeals to our kids. And I want to say I'm glad that Senators Casey, Isaacson, and Alexander have agreed to keep on working on legislation to overhaul how the Food and Drug Administration regulates over-the-counter drugs to work better for industries and consumers and make sure FDA can respond to safety concerns quickly. These are all promising steps that will help families and patients across the country. But I do want to stress that while all these steps are good, they are absolutely not enough. Repairing the train can only get you so far if you're pulling up the track at the same time. And that's unfortunately exactly what this administration is doing. There are still enormous challenges we need to address, and the biggest threat to families' health care continues to be sabotage from President Trump. In just a few weeks, as we all know, President Trump and Republican attorney generals are going to be fighting in court to strike down protections for people with pre-existing conditions, to strip away health care from people who are covered through the exchanges and Medicaid expansion, and scrap essential health benefits, requiring insurers to cover things like prescription drugs, emergency care, and mental health care, and resurrect lifetime and annual caps on benefits, even for people who are covered through their employers. So the clock is ticking on that, and families are watching, and so far Republicans have done nothing to avert what I see coming as a potential health care apocalypse that they've set up. I just want you to know Democrats are going to keep calling on them to do the right thing, come back to the table, and defend patients from these awful consequences. Now, if we come to all the agreements that we did in this bill, there's no reason we can't reach agreement on the larger challenges, too, if we're focused on what is best for patients. So I hope today can be a turning point and that we can build on the bipartisan progress represented in this legislation, that we are moving forward by working together on new steps to undo the harm that has been done by this administration and address some of the larger issues as well. And Mr. Chairman, before I yield the floor, I do want to just say, as you know, Senator Smith led many members of my caucus in sending us a letter requiring a hearing on the health and safety conditions for migrant children who are arriving at the southern border. And I just want to be on the record, I'm deeply concerned about the deaths of children in U.S. custody and the horrible mistreatment so many of these children are seeing at the hand of our government, and I'm very supportive of that request.